Thank you, Mr. Speaker. Mr. Speaker, Tuesday was a bittersweet day. It was an unfortunate day because of the government shutdown, but it was a good day because of the millions of Americans who live in the states and Washington, D.C., who finally had the opportunity to leave the ranks of the uninsured when they logged in or called the toll-free number and enrolled in affordable, quality health care coverage through the health insurance marketplaces. However, October 1 was bittersweet for other reasons for me, and I rise today as a Congresswoman from the United States Virgin Islands because on October 1st, my constituents, who are also Americans, were largely left out in the cold on this key part of the law. As a member of the Health Subcommittee on Energy and Commerce, I was at the table and an active participant in the drafting, negotiations, and amending of the Affordable Care Act. And I'm proud that I was, but it was and remains sadly clear that one of the U.S. Virgin Islands and the other territories' biggest public health and healthcare challenge when it comes to federal policy is benign neglect. Despite our efforts, still too many people, well-intentioned, just don't acknowledge that, for example, across nearly every health indicator, from HIV/AIDS, cancer, heart disease, and obesity prevalence to rates of uninsurance and healthcare provider shortages, the U.S. Virgin Islands often is worse off than the national average. And so I, working in close collaboration with leadership in my U.S. territory and my territorial colleagues, the Black, Hispanic, Asian, and Progressive caucuses, worked tirelessly to ensure that the more than 4 million Americans who live in U.S. territories, as well as our collective healthcare systems, would enjoy the positive benefits of healthcare reform. The great news is that we were in very large part successful. Today, Virgin Islanders, like other persons in the territories, are included in the consumer protections that make it illegal for a health plan to deny health coverage because of a pre-existing disease, or to rescind or deny coverage when someone gets sick, and to impose lifetime dollar limits on essential benefits. Today, U.S. Virgin Islanders can keep their children on their health plans until that child is 26 years of age. Because of the Affordable Care Act, today seniors in the U.S. Virgin Islands receive free annual wellness visits, free preventive care. They've received Medicare prescription drug rebate checks and meaningful help covering the cost of their prescription drugs. In the U.S. Virgin Islands, because of the Affordable Care Act, our community health centers and community health workers are strengthened and better equipped to serve as medical homes. But the devil is in the details. You see, the sad reality is that just because the U.S. Virgin Islanders are included in the law and eligible for these great benefits does not mean that the law has been implemented in a manner that allows them all benefits or to fully experience the positive impact that the Affordable Care Act was intended to have on every American. The law gave the governor in the U.S. Virgin Islands a choice between two options in all of the territories. One, to establish a health insurance exchange, either separately or in partnership with a state that was also setting up a state-based exchange, or two, to use the funds that would have gone towards the exchange to expand our Medicaid program. The governor, based on advice of a task force and consultants, opted for option number 2. And so amid all of the information that is being promulgated about the opening up and the enrollment of the exchanges, wonderful news for many Americans, my constituents and those in the other territories feel very much left out and unfairly treated. To add insult to injury, there are no individual policies being written, and the industry is blaming it, I think, unfairly and not rightly on the Affordable Care Act. It's important to remember that because of the Affordable Care Act, there's a very significant increase, though, in the hundreds of millions of dollars in funding for the Medicaid program, and that the governor can establish a local poverty level that could significantly increase Medicaid eligibility. The robust increase in funding for Medicaid can allow for thousands of Virgin Islanders to be newly eligible for meaningful health insurance coverage under that program. Unfortunately, though, the House passed provision that would have changed the match did not make it through the Senate, so the match is set so high that it's difficult for us and the other territories to fully utilize the increased funding. As a physician who practiced for more than 20 years before coming to Congress, I know what happens when someone's health and wellness, as well as personal finances, when they do not have health insurance coverage. It's catastrophic. That's why I've requested meetings with Secretary Sebelius to explore how and whether the monies that could have been used to establish a health insurance exchange can instead be used to making health care reform a reality for those who are uninsured but make too much to qualify for Medicaid. So there's a small but distinct window of opportunity to work with the Secretary and our Governor to think outside of the box, to identify meaningful and thoughtful solutions to the unique health care challenges facing the Americans in the U.S. Virgin Islands. Some will require legislation. I ask for the support of my colleagues on that. But also, please let us pass a clean CR to keep our government open and providing services to all Americans wherever we live in this great country. Thank you. I yield back.
The gentlewoman's time has